Hey everybody, I wanted you to listen to this real quick. I know many of you are not big Dr. Oz fans, but there's something that he said that I've been saying from the beginning with this whole battle of healthcare, and the realization that we are all living with. So pay attention and listen to what he says.
World Health Day is this week, so let's take a moment to review how our country is doing. Everyone in Washington is preoccupied by healthcare insurance reform, but our healthcare system has a more profound series of flaws. It's become far more expensive to run than America can afford. And that's in part because we pay just too much for our care. For example, in the U.S., the average cost of a C-section is about $16,000. But in Spain, it's $2,300. It's a big difference. Even in our own country, we pay different amounts depending on where we go. The average cost of a C-section in Oregon is $25,000, while in Tennessee, it's only $14,000. Now listen, guys, this all adds up pretty fast. We spend over $3 trillion, that's trillion with a T, a year on healthcare, which is higher than any other developed nation per capita, and is close to twice as high or more than many of them. Now, for our money, we do get superb high-tech solutions, but overall, our health turns out to be sort of below average, with the shortest life expectancy of the major countries, highest infant mortality, and worse health overall compared to most other advanced countries around the world, from Canada to Australia to the UK. Neither the Affordable Care Act nor the recent Republican offering can fix the underlying problems which led to this fundamental reality. The complexity of both bills reveals that they were sort of cobbled together to put a Band-Aid on a 50-year-old problem of haphazard decisions. And lots of doctors, myself included, believe that one-third of the immense cost of our system is simply wasted with no benefit to patients. Doesn't help you. So we got some big decisions to make. First off, should we start to focus our resources more on prevention and give Americans empowering tools to improve their health? Or should we devote the majority of our resources to treating illness? I'm not even going to tell you what to say, but you got to pick one or figure some combination. Second, should the decisions about your access to care be made by your state or by the federal government in Washington? That's a choice that challenges our basic political beliefs. And third, while we're making decisions, and we got to make a bunch, do we believe that excellent health care is a basic necessity, sort of like getting educated or fire protection, that the government ensures that everyone gets, or is it a privilege that you only get if you can afford it? Now, while we're debating these issues, an estimated 52 million people are going to be falling through the gaps over the next few years, in part because the care we are offering is too expensive and perhaps misdirected. So, guys, we got to be vocal with our friends that the time for the window dressing healthcare of challenges is past. We can't do that anymore. Talk to your folks, people you care about the fact we need to be brave enough to face tough decisions that will make us proud on the future World Health Day. So I give you all a lift. I'll see you tomorrow.
So basically, what he's trying to say is that healthcare should not be a situation that is a Democrat or Republican initiative. It needs to be a people initiative. And I gotta say, I watch all kinds of people that I respect, people that I look up to on both sides of the aisle, that still are fighting by the name of their political party. They're not fighting for the people, which they are. I've been dealing with this healthcare situation long before President Obama was in office. We had been trying to find affordable healthcare for our local artists. So before you start telling us, well, Obamacare or Trump care or Trump don't care or whatever you call it, it's got nothing to do with them. Like I said, in the respect of the two presidents, they've trying to find a means of fixing something that is broken way past a healthcare issue. Our healthcare is way too expensive, and honestly, I don't care if all of a sudden they do a kumbaya and it's bipartisan. It's broken on a different level that they can't fix. So we as the people need to start making some decisions. So again, you don't have to like Dr. Oz, but he's not saying anything that many of you haven't been thinking about. Peace, everybody.